Knowing and understanding what the assessors want in OET writing can give you an advantage. Watch this video where I tell you all about it. Hello, I'm Jo from Specialist Language Courses. We are OET premium preparation providers, which means you are in the right place for your OET preparation. Don't forget to subscribe to our YouTube channel for more videos like this and hit the bell so you're notified every time we post a new video. Let's get started. In the OET writing, you are assessed on 6 criteria: purpose, content, conciseness and clarity, genre and style, organisation and layout, and language. Purpose is scored out of 3 and all the rest have a maximum of 7. You can find a downloadable copy of the writing criteria on the OET website. So you can use the OET criteria as part of your preparation. If you understand what the examiners are looking for, you can make sure that you include it. Let's take a look. It's a good idea to focus on the highest band score and understand what the examiner is looking for. Aim for this band score when you practice. Think about creating a checklist and practicing to see if you can perform to the criteria. Let's take a look at one I've created for purpose. Here you can see the highest band score for this criterion. Purpose of the document is immediately apparent and sufficiently expanded as required. So your checklist should be: is the purpose of the letter clear at the beginning? Are details of the purpose expanded later in the letter? Have a look at these case notes. You are the charge nurse at Somerton Community Hospital where Mr. Smith has had a hip replacement. You are writing a discharge letter to the hospital nurse at the retirement home where the patient lives about care required. So let's look at some paragraphs expressing the purpose. Which one do you think is best? If we look at paragraph 1, too much detail has been included and it is not clear. You only need to explain the general purpose at the beginning, not all the specifics. These can be explained in detail later when you expand the purpose of the letter. For paragraph 2, here the purpose of this task is not expressed. There is no mention of ongoing care, and using refer in this case is incorrect as you are not referring the patient. What about this one? Well, in this one, the purpose is hidden within lots of detail and difficult to find. But if we look at paragraph 3, the purpose is clearly expressed and easy to identify. Let's move on to content. For content, your checklist can be: is information included important for the reader? Is all information about continued care included? Is the information accurate? If we look at the discharge plan for the James Smith case, we should include all this information as it's relevant to ongoing care to be provided by the reader. One mistake that some candidates do is not provide all the specific details of the care to be provided by the reader. Let's take a look at an example of this. If we wrote, "It would be appreciated if you could monitor his progress and provide appropriate care," the reader would not have enough details of the care required. Appropriate care is not specific enough. You also need to make sure you copy dates correctly. Here, the date has accidentally been written as a month later, and you would be penalized for this. Another common mistake is to request that the reader performs a course of action which they do not need to do. For example, here it is incorrectly expressed as something the reader needs to do, rather than just informing them that the physiotherapist will contact them to arrange physiotherapy. Let's move on to conciseness and clarity. So for this criterion, is the letter the right length? Have I included any irrelevancies? Is relevant information summarized well? Are ideas clear and easy to follow? Take a look at this example. What's wrong with this summary? So this is an example of when too much irrelevant information has been included. The focus should be on post-discharge care rather than all these details which do not impact the care to be given by the reader. The information in the second paragraph is irrelevant as it tells the reader about preoperative treatment which is no longer relevant. The reader does not need to know details such as the X-ray confirmed the fracture. All they need to know is that they had a fracture, then underwent an operation. Also, be careful not to repeat information. In this example, the operation has been mentioned twice. The past medical history is also irrelevant. It does not relate to this medical issue in this letter, and the reader would know this anyway as there is an existing relationship in place. Now let's take a look at genre and style, which looks at the type of language you need to use. Is it written in a factual way, not including language of opinion? Is the language suitable for the reader? Have I avoided abbreviations unless appropriate? Have I used polite request phrases? Using an appropriate style for the reader is important. Look at this example. This could be better expressed using a more formal style and appropriate language. The correct address, Mr. Smith, not Mr. James. We should perhaps also improve by using passive. Mr. Smith was admitted to the hospital. And more professional language such as admitted to the hospital rather than came. And he underwent a hip replacement rather than the surgeon did a hip replacement. Also avoid writing in very informal language like this. Use polite request phrases, don't use note form, and don't use informal language such as gonna. Now let's take a look at organization and layout. Is it written in clear paragraphs? Is the correct letter layout used? Is important information easy to find and not hidden in lots of detail? Are ideas logically grouped together? Have a look at these two descriptions of the patient's current situation and discharge plan. Which one is organized better? The first one is a little confusing. The ideas have not been logically grouped together, and information has been repeated. Also, the key information is hidden within the paragraph and so not easy to find. In the second one, the ideas are separated into information about mobility and physiotherapy, and a second paragraph about care to be provided by the reader and important information regarding the wound. Let's take a look at language. So you do not need to use overly complex structures. Minor errors shouldn't affect your score too much, but when errors start to cause strain for the reader, this is when they become problematic. Let's take a look at a checklist for language. Is correct spelling and punctuation used? Have I used appropriate grammar for the context? Is the language accurate? Are there any errors? Let's take a look at some examples of errors. So to set the context, all these sentences are describing a past visit to a clinic, and it is the patient's first visit in a series of visits. Look at these three pairs of phrases. Which ones do you think cause more strain for the reader? In sentence 1A, the spelling is causing strain. In 1B, there are errors, but the words are still understandable. In 2A, the first sentence is confusing, as it is written in present tense rather than past tense, and so the reader might be confused as to when this occurred. There is an error in 2b, but this is minor and does not affect the understanding of what happened and when. And in the last two sentences, 3a and 3b, 3a shows limited control of sentence structure, and the reader would need to work hard to understand the meaning. Sentence 3b does have an error, but meaning can still be determined. Top tips for the writing criteria. Make sure you understand what the writing criteria means. Use the top band descriptors to make a checklist to use when writing. Review your writing and compare with the criteria regularly, and keep a note of your errors. So which criterion do you find the easiest to fulfill and the most difficult? Let me know in the comments below. And if you like this video, please like and share with your friends and colleagues so we can help more people pass the OET exam. Don't forget to check out our website, the link's below, to see how we can help you with your preparation. See you next time. Bye. Understanding, this is when they can become problematic. I don't know what I'm saying here.